Hi guys, welcome to my channel. My name is Enorita James. I am a clinical research scientist of over 22 years experience. Today I'll be talking about different kinds of breast cancer. If you don't know anything about breast cancer, I think I have a video. I'll put a video towards the end of this video so you can go and listen to it and discover how does breast cancer even start, and probably why does it even start in the first place. It is good that you listen to that video. As I always say, I am not speaking from the point of a scientist. I'm also speaking from the point of somebody that has gone through breast cancer diagnosis, breast cancer treatment. So, what are the different kinds of breast cancer that we have? The very first thing I need you to know when it comes to the breast, there are two major places that lumps or tumors can develop in the breast. You have the lobules and you have the ducts. The lobules is where the milk is produced, and the ducts is where that milk passes through to get to the nipple and outside to be used to feed a baby. So those are the two major things you need to just put in your mind. Those are the two areas that lumps can develop in the breast. And depending on where these lumps develop, that is where you have the kind of breast cancer. And also depending on if this cancer has spread outside where it developed to other areas or tissues of the breast, also determines the kind of cancer it is. And it also depends on if these cancer cells that are developed are being fed by particular hormones, also determines how fast it multiplies. So you find that there are some people that are diagnosed of breast cancer and they tend to live longer. And there are people that are diagnosed of the same breast cancer and they don't live long. So everything boils down to the kind of breast cancer that one is diagnosed of. So the very first one I'm going to talk about is called invasive ductal carcinoma. Now, invasive ductal carcinoma is when you have a lump in the duct. As I said initially, the duct is where the milk passes through to the nipple. So when a lump develops there, it is called invasive ductal carcinoma. Now, the word invasive simply means that this lump that has developed in that place has moved from that place to the surrounding tissues. So that's why it's called invasive. If the lump remains in the duct and has not moved to the surrounding tissues of the breast, it is called in situ. So I repeat again for clarification. You have lumps that grow either in the lobules of the breast or the ducts of the breast. Now, if this lump grows in the duct of the breast and it does not grow outside to the surrounding tissues of the breast, it is called ductal carcinoma in situ. So you find out that if a doctor is writing, maybe you're diagnosed or somebody you know is diagnosed, and you see something like DCIS, simply means ductal carcinoma in situ. That is, the lump is still in the original place that it started. It is in your duct. If you see something like LCIS, it simply means lobular carcinoma in situ. That means you have the lump in your lobules, and I repeat, your lobules is where the milk is produced. You have the lumps there, and the lumps are there. They are confined there. They have not spread to the surrounding tissues. And such cancer is normally called non-invasive. That is, it has not spread. It is where it is. If it spreads from the lobules to the surrounding tissues of the breast, that is when it is called invasive carcinoma or invasive lobular carcinoma. I know the word sounds, it sounds large, but that is just what it means. As I always say, when you have an idea of what a particular sickness is, it reduces the fear. So now you know. I've talked about these two kinds of breast cancer. Breast cancer that is localized, that is in situ, normally takes a long time to spread to anywhere. And if it can be treated at that point, most times the treatment is successful. So from these kinds of breast cancer, which one is most common? I've talked about the invasive ductal carcinoma. I've talked about invasive lobular carcinoma. You find out that the invasive ductal carcinoma is the most common of breast cancers. In fact, 70 to 80% of women that are diagnosed with breast cancer have invasive ductal carcinoma. Invasive lobular carcinoma is also common, but it's not as high in occurrence as invasive ductal carcinoma. Invasive ductal carcinoma, it spreads, but it doesn't spread fast. It's not a very aggressive form of cancer. It's invasive, as I said. It can spread to the other tissues of the breast, and with time, it can also spread to the other organs of the body, which is what I'm going to talk about next. That is another kind of breast cancer. Now, when an invasive breast cancer spreads to other organs of the body, like the lungs, maybe the heart, and maybe the brain and the bones, such a cancer that has spread from the breast is known as metastasis. Now, the reason I'm explaining this thing is that, you know, at times when you see all these big words that they write, when you do a test, you do a biopsy. By the way, a biopsy is when you go to your doctor and you tell your doctor that you noticed a lump in your breast. Some doctors might decide that the very first thing they want to do is to find out this lump that is in your breast. Is it benign or is it malignant? Benign means, is that lump that is formed, is it normal lump or is it a lump that is cancerous? And the only way they can find out is to do what is called a biopsy. A biopsy is when a tissue is taken from that lump using a special fine needle. And this tissue is sent to the lab, especially the histopathology lab. And they do a test and look at these cells to see what exactly is this cell? There are certain tests that are done, chemical tests, to actually identify that these cells are either normal cells or are cancerous cells. So that is how it is actually discovered, what a particular lump in the breast is. So now, which breast cancer is more aggressive? When I mean aggressive, which are the ones, when diagnosed, they tend to multiply, proliferate, or metastasize faster, that can lead to death of a person that has been diagnosed of this kind of disease? Now, the good news is that these particular types I'm going to talk about, which are 2 of them, they are not very common. They normally occur in 1 to 5% of women. And the first one is called the inflammatory breast cancer. It gets its name from the sign that it gives on your breast. Most times it shows up like a kind of red inflammation on the breast. Something red and swollen and painful on the breast. And the problem is that most times the doctors think it is just an infection. So most times it is not quickly diagnosed until it has spread. So that's the challenge with this inflammatory breast cancer. The second one is what is called angiocarcinoma of the breast. This particular one really occurs in women that are much older, maybe 60, 70 years old. And most times in women that may have been diagnosed 8 or 10 years before of breast cancer and treated with chemotherapy or radiotherapy. So this is most frequently found in older people that have been previously treated. And the challenge is that it normally occurs in the lymph nodes that are related to the breast. Lymph nodes that are from the breast, maybe towards the armpit. That is where these tumors occur. And such cancer is what is known angiosarcoma of the breast. I have mentioned a lot of big names, but I've tried to explain what they are, in case somebody you know, or unfortunately you may have been diagnosed of it, just to reduce the fear that comes when one is diagnosed. So to summarize it, I have mentioned 6 kinds of breast cancer that are available, that one may be diagnosed of. You have the DCIS, ductal carcinoma in situ, which is a tumor that remains in the duct and has not spread. You have the LCIS, lobular carcinoma in situ. That is the lump that is in the lobules and has not spread to surrounding breast tissues. You have the invasive ductal carcinoma. That is a lump that originated in the duct and has spread to surrounding tissues of the breast. And you have the invasive lobular carcinoma. That is a lump that started in the lobules and has spread to the surrounding tissues of the breast. And then, of course, you have the 2 very aggressive kinds of cancer. That is the inflammatory breast cancer and the angiosarcoma of the breast. Thank you so much for watching this video, and I hope that all these names I have mentioned, if you see it as a diagnosis, you have a better understanding. In my next video, I'm going to be talking about different treatment methods that are available for breast cancer. And I think it's good you listen to that videos so that you properly appreciate another video that I talk about prevention methods. Prevention methods, because believe me, when you listen to the video that has to do with the treatment methods, you will not want to go through that. will be better you try purposefully to do things that can at least help for the prevention of breast cancer. Thank you so much for watching, and please share this video to people that you know it might be useful to them to listen to. Till my next video.